Welcome to the SkillTorch Disrupt podcast, where we dive into the world of innovation and technology. My name is Melica, and I am the CEO of SkillTorch, which is a digital and tech recruitment company that operates across the globe. Today, I have with me Joseph, who is the CEO of Health. He's joining us to talk to us a bit more about, the healthcare system, especially in the United States, and how that's, in relation to data and the state that it is in. So, Joe, over to you. Would love to find out a bit more about you and your background.
Yeah, Malika, thanks for having me on. It's a pleasure. This topic is near and dear to all of our hearts because, I think every one of us would love to live a long, happy, healthy life, with vitality and
Yeah.
energy and, just enjoy the journey. But sometimes it's not as simple as that anymore. We have a complicated system, and I've been at it here for 3 years with Health. Our mission is really to use data to allow for better healthcare to all. It's a big, broad mission. And, it sort of comes a little bit from the journey that I've been on over the past, 20 to 30 years, where I've worked, been pleasure working on a lot of transformational projects, in industries that transformed way before healthcare has had the opportunity. So whether it be retail or travel, financial services, industries that, some of us remember, there were days they didn't have an ATM card or Venmo or
Yeah.
PayPal. You had a world where you didn't buy on a website, or, you weren't able to, pick your aisle seat on the front of a plane. And all of these industries, they were re-architected, transformed, re-engineered because of data, making data transparent and available to the consumer, so they could make choices on price, functionality, brand, whatever. And so, during that period of time, learning a lot about what change management was, how technology enabled that, how the cloud played a role, how the internet's played a role, how the smartphone in our hands played a role, all about standardization that makes it easy. Because if you thought about it, I don't know, maybe you have 25 or 55 apps on your phone. You don't know how it interfaces to the hardware, but it just does. Every app works on that piece of hardware, whether it's an Android or it's an iPhone. This is about standardization, the cloud, it's about data, and all of that allows this transformation to happen. So now the big job is to go work on healthcare. In the United States, it's a $4 trillion industry. It's an industry that operates differently than normal industries because we in the US have a third-party payer system, which means that for the predominance of us, we don't directly pay for our healthcare. It's paid either through the federal government, through an employer, or some other plan, a third-party administrator runs for us. Maybe we make a contribution, and then there's the provider who gets paid by the payer, and then we, as the patient, are supposed to get good care. Well, without good data flow, the relationship between the three parties is not optimized. There's a lot of administrative, issues to deal with, and the experience, we wouldn't say, is the best we've ever had. So there's lots to do. It keeps me very busy, and we're on a journey to do the same with healthcare that's happened in other industries.
Right. Yeah, when I first moved out to the States, I think one of the things I was trying to get my head around is how your healthcare system works. Um, the first thing I remember, I didn't even know how to book a doctor's appointment. I didn't even know like how to go and get medicine. When I do it in the UK, you just call up the doctor, you go to your appointment. You don't think about how much it's all going to cost. Whereas in the States, there's only certain providers you can go to, and then you've got to go online or you've got to go on the phone and call up. It's very long. I managed to get my head around it. I think one of the things that they did have, and this was before COVID, they had telehealth, which we didn't really have so much in the UK. I thought that was really useful. Now, again, it's beneficial to someone that's super healthy and has no health problems, but I really feel for those who perhaps have to go and see a doctor very regularly because it's very complex, and it's only the younger, I believe, the younger generation who is more familiar with how to really navigate all of these apps and all of this that's going on.
Yeah, so it's interesting because I think that everyone has good intentions. The doctors and nurses are amazing people and they
Yeah.
deliver great care. Pharma companies are coming up with therapeutics that are helping people live longer. And there are devices that can, take a scan of our brain and tell if there's an issue, right? And so the system of care delivery is a pretty good system. The
Mm,
problem is that because of the third party payer system and trying to figure out what the best value should be delivered at what price, the consumer here doesn't have a lot of choice. And the technology has not moved along as quickly. We're still making copies of hundreds of millions of paper records every year.
mm,
There are companies still springing up that do secure faxing, so you can fax your documents from one doctor's office to another. To your point, if you need a lot of care coordination doesn't really happen easily, especially if you go out of network because the data doesn't flow and you're sort of, relegated to carrying around a folder of information. So you could only hope that the provider would be able to glimpse something into your background. The data doesn't show up for you, the minute you show up. I mean, like Google knows, where you're going today.
mm,
Your credit card company knows everything you've done. They
right.
can even tell you, hey, look, it looks like there's a fraudulent charge because they're watching on your behalf and sharing data. And so we can get there. It's not a technology issue. This is basic change management. This is about a lot of stakeholders who have something in it, who we got to move to a better outcome, which would be better care at a lower cost, higher quality, and less risk. If we can do that, I don't think anyone would argue the end game.
Mm,
The argument, if there is one, is how do you get there and what do I give up along the way? I mean, there are other, like, I love always telling about analogies because I think for your listeners, it's easier to understand. Like the electric car industry is a beautiful example. A car is a car, it gets you from one place to another. But, combustion engine cars, burning fossil fuels, both the issues that we have, whether it be pollution or otherwise, but one day we'll just actually run out. I mean, there
right.
isn't an endless supply. And so you have to have alternatives, and these alternatives, though, challenge the current status and the status quo so that, when we start bringing electric cars, well, yeah, there are not as many stations to fill up, so to speak. New habits have to form. We're used to what we did. We like that. Even when we don't, probably find the best service, we're familiar. And in the busy lives that we have, familiarity helps. So, the mission of One Up Health here is to start at the
Mhm,
basic level, which is to say that we use a common data standard. In our industry, it's called FHIR, FHIR. And that standard is based on JSON, which is a data representation used in all of the apps on the web. We use the same API structure called RESTful APIs that
right.
allow for the data transfer to happen and on, leveraging the cloud and all the new technologies that make it not matter what the platform is. It's just the end game. So our goal is to make the data, we say interoperability, make this data move better between parties so that they can collaborate on delivering care at the best price, lowest cost, and lowest risk.
So really meaningful mission there. At the end of the day, it's not necessarily just about profitability for you guys. It's actually really about like benefiting and helping society and where we are today and probably saving lives, right?
You know, uh, yeah, absolutely. The thing that I hesitate, so about 20 years ago, I was just working a lot. And maybe someone might have classified me as a workaholic. I like what I do, so I never thought much about it. But I realized that, I had somewhat become one dimensional. I hadn't really spent time exercising or, developing other parts of sort of who I am. And
Mm.
so I went on a journey to figure out if I could, sort of create vitality through the actions that I take in the way that I live. Vitality matters because as we age, and all of us are going to, by the way, if you're 25 years old and
Don't
you don't
warn me.
respect someone who's older, just don't worry, you're going to get there. So,
The life
be
expectancy of
careful what you
women is very
say.
low. It's they don't seem to pass the age of 80 or even over 75.
I know. And so I thought, if I started exercising and, now I've become an ultra endurance athlete, if I started, you know, working on better habits like how I ate. And so I gave up alcohol 15 years ago and I
Oh,
became
good
a
for you.
vegetarian and I So I decided that I put in my body mattered, how I lived mattered. And then I also wanted to sort of keep myself honest to good intentions and a value system. So I started writing 10 years ago. I've been a blogger for 10 years writing about this idea of the high performance life. I wrote a book about it. I've been on the speaking circuit because what I want to bring to the world is this message that says, look, my humble start was as humble as anyone could be, with nothing, growing up, with family as the core value that I carried forward, and time being an asset that I could use. I really put it to good measure and have had a good successful career. Ultimately, look, I'm the CEO of a company. All these things can happen to anyone, but it is through your intention, it's through your actions, it's how you live that actually changes the opportunity that you have. And so as I saw that happen, I didn't have a lot of data to be able to measure my success. So I started tracking what I did every day, and I wrote it down. When I went to the doctor, I tried to learn more about what the blood test would tell me. And I started realizing that, wow, the information that could help you live a better life is just not readily available.
Mm.
If it was, how might my life even be better? Like if I could
Yeah.
combine these habits in the way of thinking, right? The principles you bring to life with really good data so that you would know, oh, yes, this happened and this result. Wow, what would life be like? And so I'm now on this, the next 20 years is like Joe's, we call it the 20-year project, which is can, through the lifestyle choices that I make, consume little to no healthcare over the next 20 years. And imagine if tens of millions of people could make the same choice. We could save billions of dollars without
Yeah.
even systemic change, just by habits that we would change and the choices that we would make. So then I get to run a company like One Up Health, working on the data infrastructure. I get to work on my life to actually sort of reflect back the same intentionality. And, I'm just having a great time figuring this out. Certainly on my own benefit, I get a benefit. But then for, the broader community that we're all part of, it's really it gets me going every day.
I love that. I love your passion. I can hear it in your voice and see it. So you mentioned the data piece then. So did you have a background in like computer science or something, or did you just bring a few people on board that had that knowledge, and then you thought, right, actually, this is a great time to really be connecting the dots between healthcare and data?
Yeah, pretty good technology background. We always say I wasn't a great programmer, but I did start there, became an architect, then a strategist, and then really started understanding as a business leader that I could champion change using technology as a platform for transformation. If you think about what we've been able to do because of technology, I mean, even the company like Walmart, it operates the way it does, improving the lives of people who live paycheck to paycheck because it leveraged technology to get to
Mhm.
scale that it would have been able to do otherwise. And, I worked with companies like Walmart and others throughout my career, always being technically focused. Now, at One Up Health, I've built a team of people who are far more technical than I, who really can figure this out, who understand operating at scale, and some of the new sort of ways of thinking about how data quality matters, about the data, we would say lineage and provenance, which is where did the data come from, observability, so I can actually see what's happening to the data as it goes through its life cycle,
Mhm.
and ultimately sort of the data delivery, which is the ability to get it all together. So for all of that, Melica, I want to benefit from other people who are way smarter than I am. But I understand it enough to just continue to sponsor it. Each of us can play a role, whether it's as the
Exactly.
consumer of the content, or the actual, data scientist working on it. We've done some thinking about the role of AI as well and machine learning, and we think that will happen over time, but its foundation is going to be quality data. I mean,
Yeah.
we're on a path to create a platform of quality data so that if you want to use this machine learning algorithm or artificial intelligence algorithms, you can do it off of a foundation of quality. Then you could
Mhm.
trust the outcomes that it would suggest.
Yeah, well, the problem with healthcare data, I mean, to this day, a lot of the data is all being stored in legacy systems. It's been stored in very old
Hmm.
systems. A lot of it's inaccurate. I remember I worked at Experian Data Quality in the UK, and the accounts I was holding was NHS Trust and National Hospital Trust. Like yeah, they had a need for our services, but the problem they had is that the reason they weren't solving it is because they couldn't afford it. It was too expensive. So,
Mm,
there's not much you can do with old data. So what was happening with a couple of these site accounts I was working on is that, you know, there were patients that weren't authorized to be in the UK, for example, but they were on the healthcare system, and there was no way you could do anything to track that or do anything or follow up, just because it's all been stored in legacy systems and it's all old data and it's not accurate. Even just a simple
right.
thing like a zip code, we call it postcodes in the UK. you
Yeah.
know Even just matching that, like, that's that's something that was needed, and yeah, it's just all stored in old systems.
Yeah. And so you highlight one of the biggest issues that we're all dealing with.
Yeah,
So
exactly.
in the early days of technology, we did build proprietary systems because that's all that was available. And
Mm,
then we started to realize that we shouldn't argue about the data standard format or the web format or,
right.
like those don't matter. There's a lot of technology standards that underlie the success of the way our lives work.
Mm,
And so, but in some industries, we didn't adopt them as quickly. And, rightly so, in the UK, it's GDPR. We have this HIPAA thing, which is Health Information Privacy Act in the United States. We want to be really careful about information sharing in healthcare with our
yeah.
health data. So, absolutely. So, but you can do that in an open standards way and still protect with fine grained access control, access to the data by the right parties. But it did get in the way for a long time. And so now we're working towards this idea that interoperability, the ability to exchange data with partners who have a right and a need to have this data on behalf of a patient, either authorized by the patient or necessary for treatment or payment or operations, we can then start to go down the path. It's the same thing that happened, like ironically, we didn't realize, but in the airline system years ago, the reason it was so expensive was there's no data transparency, no data standardization.
Mm,
And we changed that. And when we did, all of a sudden the $2,000 flight went to $200 because of the transparency and availability of data. It allows for innovation. New actors show up. They think differently. And you know how this continues to go. So, yes, one of the most important problems to work on is the movement of data between parties that don't have the same format. This
right.
FHIR data format is the beginning of that. It's a little bit like, when the euro was interested. Sorry that the UK didn't adopt the euro, but it did change how you made payments across Europe.
Yeah.
You didn't have to have a lira and a franc. You know, you could actually just use a euro. So we know that standardization has massive impacts. Usually the obstacle is not well defended, but defended nonetheless, whether it's cultural or it's habit or it's just comfort. But we can get there. I'm confident that with time and sort of the right intention, because ours is, there isn't anything. Yes, of course, we're a commercial business and we're here to make money and grow the business on behalf of all of our stakeholders. But every day that we start with this idea that we want to use data to provide better healthcare for all.
Exactly. Well, what measures are in place to sort of ensure the transparency and security of the data that you're currently handling and working with?
Yeah, well, I think that back to that HIPAA data standard. We have a lot of people on our team who are experts in security and compliance, so they make sure that we do that. We use a combination of SOC 2 and HITRUST as third-party validators of the way that we use and store the data, so that we do that. We have ability to be audited in any way possible, so everyone knows, and we publish our standards with our customers so that they understand how data is shared. So that part, I think we feel like pretty good actors.
Mm,
We have some medical experts on our team, nurse and
right.
doctor, who also help us understand, what the data is in case someone on the team doesn't understand. And so that part, we also follow just the lead of our customers who have agreements that we sign, business associate agreements that allow us to define the rights and privileges that we have for how this data gets used. So there's nothing done without the parties understanding how that data is used. So we feel pretty good there. We also are going to work to continue to think about how to make data sharing easier for
Mm,
the benefit, of course, of the stakeholder. But that is, a journey that we're all on. And when you try and move a $4 trillion system in a direction, it's like, moving the glacier. It moves, but a lot slower than you probably would like.
Right. Just going back to the AI topic, because I know you said, the healthcare system in the United States is still way off, compared, first of all, it's really about focusing on the quality of data. But what are some of the sort of the practical applications of generative AI in healthcare that you find particularly promising?
I think that interestingly, like there's a really pretty, well, we might call it a boring use case for us. So there is a lot of source data that we want to take and put it into this common data format.
Mm,
And so we can use, sort of AI and machine learning technologies to look at very large data sets to make sense of that data so that it goes into the right place and sees the pattern of the data, not even for any clinical conclusions, but really just so that it's higher quality, that you understand, to your point, Melica, was, postal code versus zip code,
yeah.
last name, first name. There's a lot of confusion in even very simple pieces of data that over time, machine learning and artificial intelligence will help us just be smarter about the data acquisition. Once we have high quality data, then we can create these large learning models to do some care planning or just risk mitigation. We can look at patterns of data. Most healthcare outside the research realm is executed very locally. So the doctors, nurses, and providers in your community know about the wellness of that community. But if you thought about the United States, we have 340 million people. Maybe your community is a couple 100,000. You could see larger data sets providing for deeper and bigger insight into a care planner's life, who might be able to see some very arcane interactions, or maybe even, cures that could have helped someone, treatment plans that would be better. So we see that happening, but we think that that's some years off, not because it might not be good. It's just we have to fix some of the other problems first
Right.
to get really good core data, so we have really high quality data that we can feel confident using it. But yeah, it'll be there. We're not going to replace doctors and nurses with AI. We're going to complement the
How
work
is
that
that even?
they do.
That's awful. You can't do that. No.
No, no,
But
no,
the
no.
issue
So we
is,
don't
like,
think that's happening
worldwide, there isn't
anymore.
as many doctors. I don't know, like maybe like in Europe, like they're going to other countries where they can earn more money. And like, for example, in some countries, even like Canada as well, like there's just shortage of it. And it's actually not that easy to get hold of a doctor at the moment.
Yeah, that's where telehealth can play a role,
Yeah.
using technology to support the delivery and the understanding of, people that they may never have met before, didn't have any medical history. It really does help build a profile of the person. There are lots of really interesting digital health companies also that are leveraging ideas, like your digital twin, that could help you look to see what might happen if you took a different care path, versus what you might go on yourself. So there is a lot of innovation that's going to come, across all of healthcare, and it's necessary. And we're happy to be playing a role in it, more at the infrastructure and action level than at that application level. But over time, we'll probably find our way there as well.
Interesting. This might not be super related to what we're talking about here, but just something that brought to mind. Obviously, when the pandemic happened, you had the big guys. You had Moderna, you had Pfizer, taking huge profitability and huge market share when it came to sort of the COVID vaccines. Now, with that, I mean, surely they collected a lot of data about all of us, right? Or did they? Or
Mhm.
how did they sort of capitalize on that? And has that benefited healthcare as an overall society? I'd be keen to get your thoughts on that.
Well, I do. There
Very
certainly
opinionated
was.
question, but
Yeah,
yes, good.
yeah, no, no, it's a good one. There was data captured, probably not at the level and degree that we would like it to have
Right.
been. A lot of that has to do back with the confidentiality of the
Yeah.
information, how it was being delivered, etc. But it was a bit of, sort of a real life example test.
Mm,
Um, but it happened in such a fast manner that
right.
the systems underlying it really didn't track to, we did something we've never been able to do, deliver vaccines in a short period of time to a very large community of people. Some of the infrastructure to track some of the sophistication there. underlying that was not available. But we have learned an extraordinary amount from this sort of very difficult moment in human history about, what could we rally, what information is available, and then what information wasn't available. I mean,
Mm,
if we had made paying for the vaccines part of the process, we probably never would have gotten it done. The federal government in the United States had to intervene and just
yeah.
said, yep, everyone's going to get a vaccine for free. So we circumvented some of the systems that might have had some of the data go. But, this fire data standard did help some of my customers be
Okay.
able to better look at who got vaccines, who didn't get vaccines, where were they in their community. And so little by little, we were starting to see some emerging information come, but there's still work to be done to better capture information at moments like that.
Right. Okay, interesting. And then you talked about sort of cost savings and improved healthcare quality. Again, that's important for everyone's agenda. Now, how can the use of AI really contribute to that?
Yeah, I think that, if we look at every time we have saved money in any industry, it comes from a couple of things, right? So there's innovation, which is do it differently. And then there is this effectiveness, which is probably time compression and labor compression. And so less steps done by humans cost less money. Sadly, there are people who lose jobs. I mean, I don't know what's happening in the UK, but in the United States, toll booth takers, don't really exist anymore, right? We're using RFID in a car with a chip to be able to, track and pay for our activities. And so similarly, what we're going to be able to do is to have some roles, like we spent a lot of money on prior authorization. Someone is asking for approval for a specific procedure, and there's a lot of labor that's in that. Well, we can do that using AI in near real time to make those decisions. We'll save time and money by doing that. And so there are some administrative savings that can happen. There's also going to be, a lot more through the data transparency, more effective care. There are just times because the doctor or any other practitioner has not seen test results and has another test done. If the data flowed better, they would be able to see the data, trust the data, use the data, and not have to run another test. So we could save money there. We can go through many lists. It's a lot of money to actually process a patient just coming to an office because people are asking for data to be written out, data entered, saved, redone, checked, verified. All of that could happen dynamically and electronically. So we could save money there and time. So in every bit of the process, there are opportunities to use just the data, but then also the models that will help predict, and get us smarter about what we're doing.
Right. Okay. Nice. So, what are your sort of hopes and aspirations for the future of healthcare, particularly? I know you said you're really passionate about this particular subject, but in terms of extending the health span.
So I think this is going to take us probably longer than we want, but I think we could all probably agree that in the next 10 years, we're going to see significant shift in how healthcare is delivered and consumed. And that, the predominance of spend in healthcare is towards the end of our life. And so if we're living with more vitality, with quality of life, we're going to spend a lot less money later in our lives on healthcare. And so therefore, we're going to help the system. We'll make more money available then to actually figure out other ways to help humans. And so every time we save a dollar, we could actually spend that dollar
Mm,
on making for better healthcare. So what I see happening is that, this data transformation enabling both better delivery, but also innovation using the data to help deliver better care. And, really at the end of the day, I think we're just trying to catch up to what happened in the rest of our lives in other industries in healthcare. And, it's the most important industry to every one of us, right? Because the only way sometimes we can make it is to, be able to have access to the right expertise at the right time so we can make the right decisions. That's going to all help us, using data and technology. And then maybe it'll encourage us as we feel better to get outside, to walk, to do some yoga, take a run, play some pickleball, do something active every day that can, just both make you feel better, you know, in your mindset, but also feel better physically. And I think we'll all enjoy life better. And this journey will be just amazing and magical along the way.
Yeah, that's a really nice way of how you summarize it. And though we also talked about, some of the health habits that you've also adopted. So just last but not least, so there's sort of any upcoming projects or initiatives at Up One Health that you're particularly excited about?
Yeah, I think, as we go into next year, we're working on a new architecture underlying our system that probably no one will ever even notice has happened, but it's very exciting because it lets us operate at the scale of healthcare, which is billions and trillions of pieces of information. And so the place where lots of that happens is in the social media world. The kind of
Yeah.
data that flows. Similar in healthcare, we're going to make that happen, so I'm excited about that. I'm also excited about this project that I'm working on, my 20-year project, to just continue, to do my share personally in, both consuming less healthcare, but also, providing a living example for what's possible by the choices that you make. And, that's really up to any of us. There's
Mm,
no judgment in any of this. It's not like it's right or wrong. It's just knowing the possibilities open up sort of our eyes. And I think having a good mindset, starting every day being grateful for being here, wanting to make a contribution and having a legacy that makes the time that we were here worth it. So yeah, I'm excited, and I appreciate getting on the podcast and spending some
yeah,
time
thank
with you,
you so much.
Malika. And I hope all your listeners get out and do something today.
Definitely. And again, if any of them want to reach out to you, they can just reach out to you on LinkedIn, right? Once we post this.
Yeah, you can find me on LinkedIn at one oneup.health. Sorry, we're not a .com, we're a .health. But yeah, I'm easy to find, and yeah, you can read about me. I've done some other pretty fun things over my lifetime. If you happen to search for Joe Gagnon and type
Nice.
in
Look.
6 continent challenge, you'll see what I did in 2017 when I ran a marathon on 6 continents in six
Oh,
days. So
wow. That's
pretty
amazing.
fun, yeah.
Then
So
I
that was
have no
fun.
excuses to do a marathon then. I've done a half marathon and I said to myself I couldn't do it anymore. I couldn't go any further. Like
We'll
my
get you
legs
there.
are swollen for
Yeah,
days.
you're still so young. You have plenty ahead of you.
Oh my goodness. I mean, it's a great achievement though, isn't it? But it
Absolutely.
really takes a shift in your mindset, doesn't it? And you have to
Ab-
also train slowly.
Yep, I love it.
Oh, good for you. Well, well done. And thank you so much for jumping on.
My pleasure. Have a great day.
Thank you.